What will you do if a combative patient will swing at you? What will you do if an AMA hold patient will run away? Hello, this is your nurse Rebecca for Pinoy Nurse Portal. In today's episode, we will talk about how to deal with difficult, mean, and combative patients. So if you are interested, please stick around. All right, let's start with number one, how to deal with mean and difficult and rude patients. Number one, okay, do not judge that patient based on the report given to you by the outgoing nurse. Do you know why? Because that nurse might have a clashing personality that clashes with the patient. Remember, you are not that nurse is not you, okay? Never ever judge the patient based on the report you got from them. The outgoing nurse might say, oh my God, I had a difficult day with this patient. This patient is so manipulative. She is so demanding and she wants her pain medicine all the time. And then when you look at the patient's chart, it turned out that the patient only got one dose of pain medicine in the whole 12-hour shift. So imagine if you are that patient who had surgery and you only got one dose of pain medicine the whole shift. Of course, I will be in my call light also all the time, and I could be very mean to you. I'm in pain. Sometimes you have to put yourself in the patient's shoe. You have to assess the situation. Why is this patient mean? Why is this patient acting like this? Sometimes, or most of the time actually, patients act the way they act because there are a lot of needs that are not met. Because if you are sick, if you are in the hospital, there are a lot of things that you cannot control. Sometimes by calling you and being in the call light and talking to you gives the patient control, okay? Remember, put yourself in their shoes before judging them. Number two, understand the problem and the situation, okay? Let the patient speak and do not butt in when they are talking, okay? Just let them vent, listen to them, okay? You have to understand where the frustration is coming from. Remember, you are a nurse, and what's number one in the nursing process? Assessment. Yes, assess their pain, assess the situation, ask them, what are they frustrated about? This is a true story. One time, my CNA came to me and said, hey, Rebecca, 6-bed 1 doesn't want me to take his vitals because he said he ordered his tray and he did not get it. I work night shift. So when I come in, it was already 7 p.m. and the cafeteria closes at 7 p.m. So in our hospital, the patients have to call for their breakfast, lunch, and dinner. So he said he called them at 6 o'clock but never got his tray. When I went to the patient's room, I told him, hello, Mr. Smith. I heard you don't want my CNA to take your vital signs, and I heard you did not get your food. Can I offer you something from our pantry? He said, no. Don't bring me my medications. Don't bring me anything. I don't want anything from your fridge. And tell them not to take my vitals. In that situation, I could have been defensive. I could have said something. Which brings us to our number 3 things you need to do when the patient is frustrated or mean, okay? Do not be defensive. Just listen to them, let them vent out. So what I did after talking to him and listening to all his frustrations, I told him, I know, Mr. Smith, that you ordered roast beef from the cafeteria. I can offer you turkey sandwich. I know that roast beef must be good, but our turkey sandwich is better. You know why? Because it's made with love. And that's how I really said it. I told him, our turkey sandwich is made with love. And you know, I saw him smile and then he said, okay, fine, bring me that turkey sandwich and also bring me graham cracker and bring me Sprite and bring me this and all that. And what should you do as the nurse in that situation? Bring him all his demands, okay? Bring it to him as long as he's not NPO, he's not in fluid restriction, or if he's not diabetic, just give it to him. So for example, he asked for a lot of food or soft drinks and all that, but he is diabetic. What will you tell him? You are not to bring all of that. You could still negotiate now that he has loosened up a little bit. Tell him, Mr. Smith, I will be happy to bring all of that to you, but can I ask you a favor? Can I check your blood sugar before giving you all that food? And make sure to grab that blood sugar check machine and check his sugar and then bring him his food, okay? Next, Learn to apologize in others' behalf. So, what will you tell the patient? How will you apologize? This is how you say it. I'm sorry to hear that, Mr. Smith, and I apologize in behalf of the other nurse. I don't know what happened the previous shift, but I am your new nurse now, and I will do my best to take good care of you tonight. Is there something I can help you with right now? Let's say they want something for pain and their pain medicine is not due yet. What will you do as a nurse? Please call the doctor. Tell them what you will do. Oh, Mr. Smith, your pain medicine is not due in 2 hours or in 3 hours. But you know what I can do? I can call the doctor and ask for another pain medicine. And when you tell them that you will call the doctor, make sure that you are not bluffing, okay? You really have to call the doctor, okay? Because you are the voice. The patient cannot call the doctor, but you as a nurse can call the doctor. So what will you tell the doctor? So just tell the doctor the situation. Hello, doctor. Mr. Smith is asking for pain medicine. He just got oxycodone 2 hours ago. There's nothing due right now, and his pain is 10/10. So tell that to the doctor, and it's up to the doctor whether the doctor will order something new in terms of pain medicine or not. And then after calling the doctor, you have to go back to the patient's room, okay? Which brings us to the next thing you need to do if the patient is difficult or mean or is frustrated, okay? Give them reassurance. So when you go back to the patient's room, tell them, hello, Mr. Smith, I just called the doctor and let's wait for him to order something. If he will not order something in 30 minutes, I will call him again and I will keep you posted. Okay, next, be very clear with the patients, okay, with all your patients, the things you can do as a nurse and the things you cannot do, okay, or the things that are beyond your control. For example, you called the doctor and the doctor did not order an extra pain medicine and the patient's pain is still 10/10. So what will you do now as a nurse? You will go back to the patient's room and tell him, Mr. Smith, I already called the doctor and he did not order anything for your extra pain medicine. I just want to let you know that I did what I can as your nurse, but anything beyond that is beyond my control. I cannot write a pain medicine for you. Is there something else I can do right now? Something like that. You have to be very clear that you did your part as a nurse, but some things are beyond your control. Most of the time, patients will understand you. Sometimes the patient just want TLC. They want someone to talk to. Next, gain the patient's trust. If you tell them, I will show up in 30 minutes for your medication, you really have to show up in 30 minutes. You have to learn to under promise and over deliver, okay? If you tell them, I will come in 30 minutes to do this or to do that, to draw your blood, to start something like this or whatever you want to do in the patient's room, you really have to show up, okay? I know some hospitals will not allow nurses to bring their phones, but I do bring my phone at the nurse station and I use my phone as an alarm clock. If I tell my patient I will show up in 30 minutes to do their wound care, I will be there 5 minutes early as I promised, because in my practice in the USA, I learned to under promise and over deliver, okay? And if you develop that habit of under promising and over delivering, the patient will learn to trust you. Next, do not impose on your values and belief. I know we nurses are supposed to be the patient's advocate and we are here to educate. But let's say, for example, and I see this happen all the time in our unit, the patient is a smoker. The patient has been smoking since he is 16 years old. And it's in your policy that your patient are not supposed to smoke. What can you do as a nurse? Okay, listen to them. All right, and then tell the doctor that this patient has been smoking since he was 16 years old. As a nurse, what can you do? You can tell the patient, hey, I can ask the doctor to give you a nicotine patch. Okay, some patients will say, okay, I'm okay with nicotine patch, and make sure that you will really call the doctor to get a nicotine patch. But what will you do if the patient say, I don't want nicotine patch. I want to go smoke right now. Okay, this is what I will personally do as the patient's nurse. Okay, Mr. Smith, before you go outside, I just want to let you know that you are admitted in a non-smoking facility. What it means is that we cannot allow you to go outside and smoke, period. Okay, so that's what you will do as a nurse. Will I stop my patient to go outside and smoke? As long as the patient is safe, let's say he is walkie-talkie, he's ambulatory, he can go out, I will not stop him. What I will do is I will write that in my note. That's why we have a note section in our chart. I will write everything that happened and transpired. I will also write in my note that I told the patient about our policy. Okay, because you cannot change the patient's lifestyle, especially if they've been smoking for a long time. I will not personally stop that patient to go smoke, but I will tell him our policies and protocol, and it's up to him if he wants to break that policy and protocol. But you as a nurse did not break anything. You told him he's not supposed to do that, but he still did it. That's his own discretion. Next, let's talk about AMA hold patients. You will meet a lot of patients that are categorized as AMA hold patients. What are these patients? They are not allowed to leave against medical advice. They're not allowed to leave the floor. And most of the time, these patients has sitter. Okay, so what is a sitter? There is a job in the United States called sitter. Yes, you are paid to sit for the patient. You are there to make sure that they are safe. Suicidal patients, AMA hold patients will have sitter, although not all the time, but most of the time they will, for fall risk patients and many more. Okay, so let's say, for example, the AMA hold patient wants to leave the floor and that patient became verbally aggressive and physically aggressive. What will you do as a sitter? And what will you do as a nurse? Let them run away. Make sure. I'm not joking. If they want to run away and you cannot control them because they are taller than you, they are swinging at you, please make sure you are safe. Please take care of your safety first before thinking of their safety, because you can never help them if you are not safe. What will you do in cases like this? Usually before you even start working in a floor, they will give you a list of the things you should do for combative patients, for in case of fire, in case of code. In this case, if this is my patient, I will call code gray. That's what we call for combative patients. Okay, one time, true story. And I have a lot of true stories. So I have a patient, and I don't know what triggered this patient to be combative. I was like pushing medication. Maybe he felt something painful while I was pushing his medicine, and then he stood up, and then he looked at me, and he looked so scary. And then he swung at me. He pulled this IV. He jumped out of his bed and ran in the hallway. And I have a crazy nurse with me. He said, "Hey," he was following the patient. "Hey, what are you doing? Stop it right there." And I was like keeping my distance. And one of the officers who responded to this code gray got hit in the face. The patient punched him in the face. He was like bleeding. It took about 4 or 6 people to tackle this patient down. Okay. And after that, obviously, this patient is very confused. He cannot make decisions of his own. That's why we have to call security. So after they tackle him down, I got the doctor also. We called the doctor during all this chaos, and he ordered, I think, Ativan or Haldol. Okay. And after that, we restrained the patient. Can you do that to a patient? Yes, you can, because obviously the patient is confused, and you did that for his safety and for the safety of others. Okay, so lesson learned: if there are patients who are combative and who wants to leave, make sure that you are safe first before responding. Know the policies and protocol and the things you need to do in case things like this happen in your floor. And there you have it, guys. I hope you learned something in today's episode of Pinoy Nurse Portal. Once again, this is your nurse, Rebecca, saying thank you. And if you're not a subscriber yet, please don't forget to subscribe and follow me on my social media accounts. It should be here. Okay? Thank you so much for watching. See you on our next vlog.